Hi everyone! Welcome to our video about the muscular system, the amazing body system that helps us move, breathe, speak, smile, and even digest food. In this presentation, we'll cover the different types of muscles, how they're named, how they work together, and their roles in every part of the body from your eyebrows down to your toes. Let's get started.
General muscles and classification. Muscles group work in position. Muscles don't push, they pull. That's why skeletal muscles are arranged in possessing pairs across joints. While one muscle contracts, the opposite one relaxes. For example, when you bend your elbow, the biceps contract and triceps relax. When you're straightening it, the roles were reversed.
Muscle roles: agonist, antagonist, synergist, and fixator. Agonist or prime mover, main muscle responsible for movement. Antagonist opposes the movement. Synergist assists the prime mover. Fixator stabilizes the bone or joint during movement. Think of it like a team. The star player is agonist, backup, synergist, and referee antagonist.
Muscle naming criteria. Muscles are named based on many factors. For example, location, brachialis or arm, shape, deltoid or triangle, size, gluteus maximus, or also called as the largest glute muscle, direction of fibers. Rectus is equal to straight, oblique is equal to diagonal. Number of origins, like biceps, is equal to 2 heads. Attachment sites, sternocleidomastoid or sternum clavicle mastoid. Action could be flexor, extensor, or etc. Some names use multiple criterias, like extensor carpi radialis longus.
The action of a muscle can interfere with the position of a muscle relative to the joint process. For example, the anterior side of a joint produces flexion. The posterior side of the joint produces extension. The lateral side of a joint produces abduction, and the medial side of a joint produces adduction.
Types of fascicle arrangement. The pattern of muscle fibers or fascicles affects the strength and range of motions. Circular surrounds openings like mouth or orbicularis oris. Convergent, broad origin to narrow intersections like pectoralis majors. Parallel, fibers run parallel or sartorius. Posterior, spindle-shaped like bicep brachii. Pennate, feather-like, most powerful, like rectus femoris. Parallel muscles move farther, pennate muscles are stronger.
Lever systems. Lever basics. A lever is a ragged bar that moves on the fulcrum in the body. Bones is equal to levers, joints is equal to fulcrum, and muscles is effort. Body parts is load.
Mechanical advantage versus disadvantage. If effort is farther from the fulcrum, then the load is equal to mechanical advantage, slower but stronger. If effort is closer, is equal to mechanical disadvantage, faster but less force. Classes of levers: first class, effort, fulcrum load, nodding head. Second class is fulcrum load effort, standing on toes. Third class is fulcrum effort, load biceps curls, most common in body.
The overall organization of the muscular system is all the more impressive because of the sheer number of skeletal muscles in the body. There are more than 600 of them.
Head and neck muscles. Facial expression muscles. These insert into skin, not bones, so they move your face. Example, orbicularis oculi closes your eyes. Zygomaticus is for smiling. Frontalis is for raises your eyebrows. Orbicularis oris is for puckers your lips.
Muscles of mastications. Used for chewing, masseters temporalis is equals to bite force. Pterygoid muscles is equals to grinding. Tongue muscles help in speaking and swallowing.
Neck muscles, swallowing, head movement, and posterior muscles. For swallowing, suprahyoid and infrahyoid groups. Head movement, sternocleidomastoid for rotation, and scalene for flexion. Posterior muscles, extension. For example, splenius capitis. Breathing muscles, diaphragm and external intercostals. Diaphragm for prime mover of inspiration and external intercostals for lift ribs. Abdominal wall muscles. These four pairs form layers like plywood. External oblique, internal oblique, transversus abdominis, and rectus abdominis.
Pelvic floor. Pelvic and perineal muscles support pelvic organs, resist pressure, and help control urination, defecation, and erection. Key muscles, levator ani and coccygeus. Upper limbs, thoracic muscles, move or fix the scapula or shoulder blades. Trapezoid serratus anterior, muscles crossing the shoulder, pectoralis major, latissimus dorsi is equals to flex, extend, or abduct arm. Deltoid is equals to abduction. Rotator cuff is equal to stabilizes shoulder. Arm muscles anterior, biceps brachii is to flex, and posterior triceps brachii is to extend.
Forearm muscles. Anterior to flex wrists and fingers. Posterior to extend wrists and fingers. Pronator helps rotate the forearms. Intrinsic hand muscles. Thumb to pinky fingers. Small but precise. Allow gripping and opposition.
Lower limbs, hip and thigh muscles. Anterior, iliopsoas, rectus femoris is equal to flex thigh. Posterior, gluteus maximus, hamstring is equal to extend tight flex legs. Medial, adductors is equal to bring thighs together. Leg muscles, anterior, tibialis anterior is equal to dorsiflex foot. Posterior, gastrocnemius soleus is equal to plantar flexion. Lateral, fibularis is equal to eversion. Foot muscles support arcs, move toes, like hand, they are layered and precise.